Imagine a life without any wheat, rye, or barley. That means none of your typical breads, cookies, cakes, or pizza.
That's the reality for 1 out of every 200 people. Not because they're going low carb, but because they've been diagnosed with celiac disease. Michelle Dunaway explains in today's MedWatch report.
Carriers.
When Linda Bickham's family came down with the flu in 1970, she was the only one who didn't get better.
I started losing weight, and by the time I was diagnosed, I had lost 40 pounds. And my mother was very concerned that I had cancer or something.
But Linda didn't have cancer or the flu. Doctor said she had celiac disease.
He gave me a sheet of paper and said, avoid these foods and see how you feel. And I felt better.
Dr. Robert Barnes says the condition is basically a gluten allergy.
It's actually an immunologic response that causes damage to the small intestine. And the result of that is that damage leads to diarrhea and the loss of nutrients.
Many sufferers are either misdiagnosed or undiagnosed.
And the reason for that is because of the varying degrees of clinical symptoms. In other words, some people will have more of a bloating picture or more of a, even sometimes a constipation type of a problem.
But once the diagnosis is made, the treatment is eliminating all foods containing gluten.
You get the diet and you say, whoops, wait a minute, I can't eat anything that has flour in it. So it's a big adjustment.
An adjustment that is gradually getting easier.
Fortunately, the grocery stores and the major chains are becoming more aware of the celiac and the need for a special diet. So they are producing and packaging more gluten-free foods with the labels on them.
For Linda and those like her, it's making life a little easier to swallow.
The more that we can get the information out, the better celiacs will be able to live a more normal life.
For 9 and 10 News MedWatch, I'm Michelle Dunaway.